Hello, I'm Shelby. I'm with Respiratory today. So first we're going to, we're presented in the ER with a cardiac arrest respiratory failure patient, a 60-year-old male that is 6 foot, and his ideal body weight is 80 kilograms. So his ABGs present with a pH of 7.25, a PaCO2 of 60, a PaO2 of 30, and a bicarb of 24. So this patient is suffering from uncompensated respiratory acidosis with severe hypoxemia. His vitals are a heart rate of 120, a respiratory rate of 30, a SpO2 of 75%, and a blood pressure of 80/65, and an end-tidal CO2 of 60. So this patient does need to be intubated. Okay, so I'm going to put my gloves on, and I'm going to start by bagging the patient while my assistant gets all the intubation equipment ready. Okay, so my patient is 80 kilograms, so I'm going to need a size 8 tube, but I'm going to remember to bring a 7.5 and a 8.5 tube with me, just to ensure that in case the patient has any airway troubles, that we have different size tubes to accommodate the patient. Okay, so my assistant has all this equipment ready. He's handed me the laryngoscope and the ET tube. Okay. I'm going to start by visualizing the vocal cords and using my size 8 tube to intubate the patient. So since this is a size 8 tube, it's going to be at 24 at the lip. I'm going to take my stylet out. And then we use the capnometer to check the CO2 in the lungs. Wait a second. So yeah, to check the CO2 in the lungs, this ensures that the tube is in the right place. Other things we can do is use the stethoscope to check the breath sounds, to make sure the tube isn't in the stomach. And we also use the chest radiograph to visualize that the tube is in the right place. So now my assistant is going to inflate my cuff. Okay, and while he bags, I'm going to check the pressure of the cuff. Okay, so you know the cuff is in the has the right pressure if the line is in the green area, which it is. Okay, so now we're ready to secure the tube. This is the Hollister that we're using to secure the tube. Thank you. Go. Okay, and you can also use tape or any type of commercial device to secure this tube. All right, now the patient is ready to be connected to the ventilator. Okay, so my patient is connected to the ventilator, but before we do that, we're going to connect the ventilator to the oxygen source that's located on the wall at 50 psi. The mode that we're using today is AC/DC, so assist control, volume control. We're going to hook this patient up to a servo eye ventilator, but before you bring the ventilator into the room, you're going to make sure you do a ventilator pre-check, just to make sure that the ventilator is working properly. But it's important to make sure you know to do this before you bring the ventilator into the room so that there aren't any complications when trying to ventilate the patient. So today we're going to do a tidal volume of 30, a tidal volume of 300, a respiratory rate of 14, FiO2 of 100%, and a peak of 8. So as you can see, like I said before, we're in volume control. These are the parameters we've set for the patient. So like I said, at 300, for video purposes, the respiratory rate is going to be at 12, and the FiO2 is going to be at 21%. But just like I said earlier, it's going to be at 100% and 14, and the PEEP is at 8. So yes, these are the parameters. So for the alarms, you're going to make sure you set the tidal volume 2 below and 4 above. So it's going to be at 5.5 and at 40. The respiratory rate is at 12 and 35. And the end expiratory pressure is 2 below and 2 above. So that's going to be 6 and 10. And as you can see, our patient is breathing adequately. There are no alarms going off. So yes, this is the parameters and the alarms for this patient. So as we go into weaning, you're going to make sure you set the mode to SIMV. So this ensures that the patient is breathing spontaneously or breathing on their own. So you would also do a spontaneous breathing trial. So this helps the patient breathe on their own. It lets you know how much they can, how long they can breathe on their own. And so yes, so by doing the spontaneous breathing trial, you will adjust the pressure support until the patient reaches a spontaneous frequency of 20 to 25 or a tidal volume from 8 to 10. And for further weaning, the pressure support level is reduced by 2 to 4 centimeters or as tolerated by the patient. So if the patient reaches a pressure support of 5 to 8 centimeters of water for 2 hours with no sign of respiratory distress, then the patient is ready to be extubated. So for extubation, you have a whole procedure with that. You will sit the bed up, have the patient cough, and take the tube out that way. You'll make sure to have racemic epinephrine on the side, just in case the patient is suffering from any stridor. And so yes, you will also have your intubation kit on the side as well, just in case the patient fails extubation. So for my patient, he was successfully extubated and placed on a nasal cannula at 6 liters per minute.